Hello, my name is Corey, and today we'll be discussing ABG stick prep. Now, before we start, what is an ABG? An ABG is an arterial blood gas test in which we draw our blood from the arteries to find CO2, O2, bicarb, and pH. Now, before we start, you'll need to prep your gear. Now, some of the gear you'll need is alcohol prep pads, gauze pads, a needle, some gloves, and medical tape. Please note that I set 2 pieces of medical tape aside so that you can use them later after you've performed your ABG. Now, after preparing your gear, you'll need to check your information. Now, you do this in order to make sure that you have everything on the patient is correct, such as their name and number, and to know any risk factors that they may have, such as the use of blood thinners. Now, after you do that, you'll have to introduce yourself. Now, first thing you do is to knock on the door, and after that, you'll walk in, say hello, state your name and position, and ask for their name as well. Then you'll have to go wash your hands and check and don your gloves. To which afterwards you'll be checking their band to make sure that their information is correct. Anyways, after introduction, we'll be moving on to hygiene. Now, to make sure, which I mentioned earlier. During hygiene, you'll be heading over to the sink, washing your hands, drying your hands, and then putting your gloves on to prevent the spread of infection. Now, after that, we'll be performing a modified Allen's test. Now, what is a modified Allen's test? Well, a modified Allen's test is a test in which you use to determine the blood flow circulation in one's hands by blocking the radial and ulnar artery. Now, if the radial artery if the radial artery shows circulations, you may proceed with your ABG. If it does not, then you'll have to move to another site. Now, quick demonstration on how it is performed. Now,
hang on. I paused it for you.
Okay, good. Thank you.
Okay.
Now.
Okay.
Now.
3, 2, 1. Hang on. I paused it for you.
Thank you. I need a small break here.
You're okay.
That's a lot for me to do in a little time. Okay, last one is site prep. I'm gonna move over to here, get this ready, move this to the side, so that way.
Do you want me to show your face or just your chest and below?
Just my chest, but don't start just yet. I'm gonna give a quick refresher, really quick.
Check pulse first.
Okay.
And you can say if you want.
Check pulse around the radial. Check for.
And remember, you can elevate it if needed.
Yes. Yeah. Okay. Let me just run this through before we hit play again, really quickly. Okay, finally we're going to do prep the site for your stick. Now, in order to do this, we'll be looking for the site in which you'll be sticking. In this case, the radial artery. This may be elevated to make this easier with a rag or a pillow. Then, after that, you'll be cleaning the site with an alcohol prep pad. Now, please note that before you start, you need to let it dry.
Mm-hmm. Then
after the area is clean, you may perform your ABG, and
that's how you prep.
And that's how you prep. Yeah. Okay. Yeah. And that's how you prep. And that's how you prep the site for an ABG. Okay. Good. Okay. Let's start.
And then after that, though, after you said, and that's how you prep the site. Hey, stop. Oh, crap.
Site for your ABG. Now, in order to do this, you need to find the radial artery to find a pulse. Please note that you can elevate this with a rag or a pillow in order to make this easier on yourself. Now, after you find that, you need to grab yourself alcohol prep pad and clean the area down real well. Please note that it needs to dry before you can perform your ABG stick. And after all that, you've successfully prepared the area for an ABG, and you can proceed with your procedure.